Our next guest says a government-run healthcare system saves costs by denying care. He is a member of the AMA, a practicing physician, and a member of the GOP Healthcare Task Force. Joining us now in a Fox Business exclusive is Representative Bill Cassidy, Republican of Louisiana. Welcome, sir. Thank you for joining us.
Good to be here. Thank you.
You've got a great perspective being a practicing physician as well. The plan was announced today. We've seen broad strokes. We need to see the fine details, of course, but what's your first impression?
Well, when I say I practice as a physician, actually, I've been treating the uninsured 90% of the time for the last 20 years. So the first thing I'll say is, isn't it great we're speaking about reform? We can start taking care of my patients. But my second impression is that this is a speech of someone who's read a policy paper and not someone who's been in the trenches treating patients like I have for the last 20 years. A great policy paper would be a good dissertation.
But he did bring in the AMA, of which you are a member, certainly. He has spoken to doctors. We checked on that. Are you saying that all he did was look at policy and not really get into the deep details with doctors themselves? Doesn't seem right. I mean, he actually has addressed the AMA this time around.
Well, you addressed the AMA, but as you read that, where do you see the statement point blank that patients are central? I know in my practice in a public hospital in Louisiana, treating the uninsured, that unless patients are central to the process, it never is going to be reformed. I don't think I ever saw that in there. And again, there were broad strokes about what others call accountable health groups and other things that a policy analysis paper are going to refer to. But I'm never sure I saw a detail about how we're going to make that patient in the middle of the process.
I've always felt, and I've said this before, my dad was a surgeon, I've always felt that you ask the doctors how to handle this, and you being a doctor, you've got some ideas, we've got them up on the screen, and what you've said is there should be vouchers or tax credits to ensure access, along with reform so Americans can purchase traditional insurance, and of course protect against medical bankruptcy. Very, very important. But if you were to have President Obama's ear, do you think, A, you could get it, and secondly, if he incorporated a couple of your ideas, would a compromise be something that you would vote for?
Well, a couple things. Of course, working backwards, if we can get a compromise that puts the patient in the center of the process, because only then will you ensure quality of care and control cost. Would I vote for it? Absolutely. I'm not dogmatic on this. Having said that, as a Republican and part of the GOP working group, we have not been approached by our Democratic colleagues in the House of Representatives. In fact, they've been behind closed doors and have released very few details as to what they hope to bring forward. I would love to be part of that process, and if it's something that guarantees access, controls cost of high-quality care, I am for it.
All for doctors, especially who are in on the inside like you are, getting their word out, and I really hope that through Fox Business we've been able to do that. And let us know if you're able to get anybody's ear on the other side. We would love to hear what happens, Representative. Thank you so much for joining us.
Thank you very much.
Representative Bill Cassidy, Republican from Louisiana, and of course a practicing physician. Now let's hear from the other side.